Next up, we've seen you before. Alexandra.
All right, so I'm still a PhD student at Brown University, but I'm switching hats a little bit to present this work from a team of collaborators at Boston University, just north of us. And this work is about minor consent laws for substance use disorder treatment in the United States. An alternate title to this could be Kids Use Drugs Too, and so we need to think about ways that minors can actually access services if and when they need them. So just broadly, parents and guardians typically need to provide consent for their minor children to receive health services across the board in the United States. And so this means that in order to receive certain types of care, minors would need to disclose information about maybe their drug use or their sexual behavior to their clinician and guardian. These disclosures can be difficult, risky, or impossible for adolescents whose guardians may react with discipline, rejection, or abuse, or for adolescents who are unstably housed, maybe not living with their guardian, institutionalized, or in foster care. And so to address parental involvement as a barrier to care, a lot of US states have then enacted statutes that grant minors legal capacity to consent independently to health services and don't need their parents' involvement. So most states, or actually all states, have this for STI and HIV testing and treatment, but there's still quite a few barriers for getting STI and HIV prevention services, as well as other types of care, including substance use-related care, which is pretty vague, and then also mental health care. And so our team has assembled data on minor consent laws in all 50 US states and the District of Columbia. So we've documented minor consent laws for healthcare generally, and then also these specific types of services. So services for HIV, sexually transmitted infections, mental health, and substance use. Here I've highlighted the number of states that have enacted laws related to substance use disorder treatment over time. Notably, in 2023 and 2024, you actually see these graphs start to go down. 3 states acted simultaneously to revoke minors' capacity to consent to medical care, and this is the first time we've seen sort of this backwards shift in legislation. These laws are also a little bit hard to interpret in terms of what they mean by substance use disorder services and what types of services some of the statutes are actually referring to. We've separated them into 3 categories because these laws map on pretty well with mental health services as well, so we can kind of break it into outpatient, inpatient, medication. But like here, by outpatient care, we're really just kind of referring to talk therapy. And so you can see that there's still a lot of states that do not allow minors to independently receive clinical care for substance use-related needs. And so harm reduction services should continue to expand to adolescents in the coming years, of course. And so with that should come information for minors about how they can navigate accessing these treatment options should they choose to engage with services without their parents' knowledge or consent. The mental health and substance use disorder related laws are not yet publicly available, but you can scan this QR code and you can get access to a longitudinal data set of the history of these laws from 1900 to 2024 for all US states for HIV and STI services if you scan there. And then I encourage you to reach out to Kim Nelson, who's the PI at Boston University, if you have other questions about this work. Thank you.